Hello, my name is Carissa and I am the Education Manager for Nursing Education and Training Australia. And we are the pioneering OBA preparation class provider in Australia and also halfway across the globe. Today we will be discussing about who we are as Nursing Education and Training Australia and the outcome-based assessment preparation class and its components and how we, your educators, will be able to help you to pass your outcome-based assessment. So I am going to share my screen. And you can see our PowerPoint presentation. So it's us, NETA, and we will be discussing the outcome-based assessment, its components, the preparation class that we provide, and what do you do before, during, and after your assessments or your test. So what you can see in the screen would be your educators, the funny and the lively ones. And this was taken during our Educators Development Day because we are continually developing ourselves to be able to help you as well achieve your goals. So who are we? We are the pioneering preparatory class provider for both NCLEX and OSCE. We did start earlier this year as well when APRA did rule out the 2020 new process for the registered nurses overseas. So we work across the country. Our educators are across the states of Australia. So we do have educators from Brisbane, we have educators from Victoria, we also have educators from New South Wales and all over New South Wales. And also our offices are located in Wagga, New South Wales, and also in Sydney, New South Wales. Our clients are halfway across the globe. And what does it mean is that we do have clients interstate in Australia, but also we do cater clients who are in the comforts of their home overseas, such as Philippines, India, Nepal. And we also have clients that are also in UAE, Malaysia, Singapore, Abu Dhabi, and the Asian countries as well. Our simulation laboratories are located in Sydney. We partner with Melbourne, Brisbane, and we're building one as well in Adelaide. And our main offices, as I said, is in Wagga, and we do have a branch in Sydney. So our vision is that we will be the preferred education provider for the outcome-based assessment for internationally qualified nurses. We are getting there with our vision, and I think we have to change this vision next year because most of our students are actually coming to NETA for their OBA preparation class. And our mission is 100% passing percentage for all OBA takers from NETA. We are also close to this. At the moment, we have 96.7% passing percentage, and that would include as well to those students who we did not recommend to take the test. Unfortunately, we still count them in our passing percentage. But good news, majority of our students did pass, which means that our program is really working as well to internationally qualified nurses. We also are very strong with our values when we deliver our preparation course and also when we work in NETA as a team. We value your knowledge. We value that you are already a graduate of Bachelor's of Science in Nursing, and that means that you have these learned concepts in nursing already. As an education provider for the preparation class, we are here to support you, make sure that you recall all those learned concepts in university. And for NCLEX and OSCE, it is more of the application of your learned knowledge, concepts, and skills. So we value that. We honor that you are capable already. We honor that wherever you come from, your nursing council has actually invested their trust upon you that you are capable to look after a patient safely. We also value support when it comes to our with our students and also to our educators and also to the whole team. So we support you by making sure that we have provided a very structured program, and we also support you by making sure that you are on the right track. And if you are not on the right track, we put on strategies to ensure that you are actually in the right track. We also support our educators, and as you can see, the first photo of this presentation, we always have our development days as well. We do have fortnightly meetings with our educators to make sure that they're well supported, and also with our team where we do a weekly meeting as well. So that's where our support comes in. We understand that we work interstate, and we don't want everyone to feel isolated, and that's the reason why we are here virtually. We respect that every one of you has the right to be heard. We also respect that everyone needs a psychologically safe environment. So, as a future student of NETA, we can assure that you will be part of the family. Most of our students actually feel that we are a psychologically safe environment, a very safe place to learn, and also a very safe place to share your brilliant ideas and your wonderful experiences and skills. We are a team as well, so we value teamwork. We know that you are already registered nurses, and the only difference is that we are registered nurses in Australia and you are not just yet. However, we work as a team. If there are things that we need to work on, we work on it together. If there are things that we need to find out, develop, do some quality improvement, we really value the thoughts of our student, because that's how we work in NETA. You can also see this very strong team in the team itself at NETA. The students can feel how strongly bonded we are as a team in NETA, from our admissions to marketing to accounts to our educators and to the whole operation itself. We value transparency, and that is the reason why whatever you see from us is what you get. What we provide to you is what is really correct and true. We stand by this value by providing truthful information, and you can see that how genuine our marketing team is, and also you can see how genuine our educators are as well. So the first step for you as a future student of NETA is that you will be asking yourself if you are eligible to become a registered nurse in Australia. As much as we want to tell you that yes or no, the best authorizing agency to tell you if you're eligible or not is APRA. So APRA, Australian Health Practitioner Regulation Agency, is a registering body in Australia that deals with 14 other professions, and nursing and midwifery is one of those 14. So as a registered nurse, we are governed by the Nursing and Midwifery Board of Australia under APRA. So if you go to our website, which is nursingeta.com, or www.nursingeta.com. You scroll down to the bottom, you can see this pink tile, and it's got self-check as well on the right side. So that will lead you to the self-check page in APRA, or the Nursing and Midwifery Board of Australia. The self-check is very straightforward. It is probably about 5 minutes for you to do it. It is completely free of charge. And what it will ask you are very simple questions. It only needs your memory. So the first thing is that it will ask you about what is the qualification that you are applying for, if you have held previous registrations in New Zealand, Australia, and if you have any qualifications that pertains to nursing. So you need to enter your qualifications, the date that you have graduated, and then APRA will then let you know what is your next step. If your qualification is not suitable as of yet, APRA will then advise you to upgrade your qualification. If your qualification is acceptable for the OBA, APRA will then let you do an account. So you need to write, or you need to make an account, and then you will then see this in your dashboard inside your account. So we will direct you to a different video for your self-check, but this is what you're going to see after you make your account. So if you have these 6 steps that identifies the MCQ and OSCE, definitely you can do the preparation class. So the first step is your IQNM assessment fee, and this is the International Qualified Nurses and Midwife Assessment Fee, which is 640 Australian dollars. So you need to pay this online if you want to proceed with the process. And once you pay that online, you'll go to step 2, which is orientation part 1. Your orientation part 1 is a 2 to 3 hours of an online learning where the NMBA will showcase the healthcare in Australia and how we, as registered nurses and midwives and even enrolled nurses, how do we play a part in the Australian healthcare system? What are the standards that are expected of us as registered nurses? Once you finish your orientation part 1, you will then proceed to your portfolio stage. Your portfolio stage is when you need to provide certified true copies of your identification or your proof of identity. Depending where you are, if you are overseas, your passport is good enough. If you're already in Australia, you need to provide 100 points of identity. We will also have a different video about your 100 points of identity. This probably would then take you a day to upload all of your documents in the portal or on your dashboard. Once you finish with your portfolio stage, the response time of APRA will vary. Some students get a response in 2 weeks, some students get a response in 2 months, some students get a response in 3 months. For us to be safe, we will say that there is an average at about 2 to 3 months waiting time before APRA will tell you that you can now register for your MCQ, which is your step 4. So your MCQ is the National Council Licensure Examination, or NCLEX, which we'll be discussing shortly. It is a computer adaptive test that deals with the theory of your nursing knowledge, concept, and the application of these. So once you pass your MCQ, you will then proceed to your OSCE, which is step 5. And once you pass your OSCE, which is the Objective Structured Clinical Examination, and this is a practical exam, once you pass that, then you are now eligible to apply for your nursing registration. So let's go into details. Let's talk about how much would it cost and how long would it take, because I know that this is what the students would ask. So your IQNM fee, as we said, it's 640 Australian dollars, and this is automatic. If you pay now, you can access your part 2 or step 2, which is your orientation part 1. Your orientation part 1 has no fee, and I've put an asterisk there 1 day. Depending on your time, you can go back to this and you will have 30 days to complete your orientation part 1. So you'll have 1 day. That is the average. Most of our students said 4 hours because they really read all of the link that APRA has provided, which is very good. Some students said it took them about 2 hours. So let's say half a day, you will finish your orientation part 1. The next step is your portfolio. So once you finish your part 1, you will have your portfolio, which is of no fee as well. And depending whether you have all your documents certified by the Justice of Peace or certified by an authorizing person, then you can upload it straight to your portal. It's got some rules there as to how big is the file and what type of file you should be uploading. So normally it should be a PDF or a JPEG file of not more than 5 MB. So once you've finished that, you will then upload. So that's your 100 points, proof of identity, or if you're overseas, that's your passport, and also a copy of your qualification and your transcript of records. That is of no fee as well. Then you move on to the MCQ. So your MCQ is 350 US dollars. That is divided into two separate payments. The first one is 200 US dollars with GST, and that is for you to be able to register for your NCLEX through Pearson VUE. Once you have registered for NCLEX or Pearson VUE, APRA will then provide you with an authorization to take, or your ATT, which you need to use for you to be able to book for your test. So when you book for your test, you have 30 days to book, 3 months to book for your test. With COVID, APRA is providing it for 6 months. However, business as usual, it is only 3 months, and that is the time that you need to pay an extra 150 US dollars if you are taking it here in Australia or even outside of the US. So 150 US dollars plus GST, and that makes it 350 US dollars. So as I said, you have 3 months period to take the exam. Once you have finished your examination, you will then be advised by APRA. Congratulations, you have completed your MCQ. Now you can proceed to your next step, which is your OSCE. So your OSCE is 4,000 Australian dollars, and it is a practical test for international students, and this is held in Adelaide. So once you have paid for 4,000 AUD, APRA will advise you, or the NMBA will advise you of the test dates, and you need to book that test date as well. So in the OSCE handbook, APRA has provided an information that they have different cycles of the test. Each cycle will have 2 days, and each day will have 2 sessions, one in the morning and one in the afternoon. So you will need to book either the morning or the afternoon session, and there will only be about 40 students per session. So it's quite competitive. So it is really important for you to consider if you're ready to take the test before you pay the 4,000 Australian dollars. Once you pass the test, you will then proceed to step 6, which is to apply for registration. That will cost you $175, and that's AUD. And in the website, it says that you probably would take about 3 months to obtain your registration. So another detailed information about the documentation that is required. So your IQNM fee, there is no documentation required in that stage. For your orientation part 1, no documentation required. For your portfolio, you need to have your certified copy for your proof of identity and certified copy of your qualifications. Some registration officers will ask you for your certificate of registration in your home country. We advise that you make it ready or even upload it during your portfolio stage. So everybody should follow the guidelines for certifying documents. You can find this information in the APRA website simply by typing certifying documents. Once you're done with your portfolio stage, you proceed to step 4, which is MCQ. There is no documentation required for MCQ, but if you would enroll through NETA, we require a proof of your identity and a copy of your self-check or any proof that would state that you are taking the MCQ. For your OSCE, no documentation as well required from APRA. If you enroll to us through your OSCE, we need your identity document and also the proof that you have passed your NCLEX. And also for your registration, for Stream B candidates, there are different types of supporting documentation, and this is where you will need to provide your English language test. And you can find this information in the APRA website, and you will also need to provide your criminal record check or your fit to work, and also your application form, your experience certificate, your CV, and also a proof that you have passed your MCQ and your OSCE. So let's talk about NCLEX. What is NCLEX? So as we said, it is a National Council licensure examination. The provider of the test is the National Council of State Boards of Nursing, or NCSBN. This is step 4 in the portal, where APRA has defined as multiple choice questions or your MCQ. The test is done through Pearson VUE, and we will show you later on as to where are the Pearson VUE centers here in Australia and overseas. So the test is delivered according to the NCLEX test plan. So the students are asking us, how would you know what to teach? We always say that we base our program through the NCLEX test plan. Going back to our mission that we want you to pass 100%, the delivery of our class is quite different from what is in a traditional way of delivering the class, where the students sit down, listen to the teachers, and the teachers provide all the information. This time we're doing a higher level of thinking, because according to the NCLEX test plan, NCLEX will be asking you questions that are not learned in your university. These are all the applications of your skills and knowledge that you learn in university. And I will show you a bit later on an FAQ, or frequently asked questions, about the level of knowledge that NCLEX will be asking you, and probably that will give you a better view as to why we are not doing a traditional way of learning. It is a computer adaptive test, and what does it mean is that when you sit down in your exam, you answer the test. If the question is answered correctly, NCLEX will then automatically give you a harder answer. So the level of difficulty will actually go higher as you answer the questions correctly, and the level of difficulty will go lower as you answer the questions wrongly. So APRA will then judge you whether you're a safe practitioner or you're not a safe practitioner, and that is how they're going to determine whether you pass or fail the exam. There's no such thing as passing percentage for APRA. They will only judge you according to how you make decisions to your patients at the time when you answer your question, whether or not you're safe, you're a safe nurse, or you are an unsafe nurse. So the question is, what if I will pass the test? Congratulations, you will then move on to your OSCE. What if you fail the test? Failing the test would mean that you will need to reapply for your ATT. So you need to advise APRA that you want to take the test again. APRA will then let you register for your NCLEX test, and then you will receive another ATT. You pay for another $350, and then you book for another test. There is a 45 days downtime period, and when you say downtime period, this is a cooling off waiting period. Not that you will do something else, but NCLEX and NCSBN wants to make sure that you actually consider the feedback that was given to you by NCSBN on how you did on your test. There will be some feedback as to which topics you need improvement on, and you need to work on that within that 45 days. So it actually allows you time to prepare for your next test. So I am just going to quickly share. So This is the NCSBN website, and this is where you can get factual information about NCLEX. It is good to listen to your friends, or if you have agents, it's also good to listen to them. However, if you want more information and also correct and factual information, this is the website that you are going to go. So it's ncsbn.org. When you go through the website, you will then see on the upper left corner NCLEX and other exams. Click on that, and NCLEX resources and information will be found here. So you can see before the exam what you need to know, when you register for your exam, what do you need to know during the exam day, and also after the exam. We were talking about the testing location a while ago. So we have the testing locations on the left-hand side of the screen, and you just have to click test centers, and it will lead you to a page where you can search by address. So say, for example, you're in Australia, you type Australia, and then it will show you the testing centers in Australia. So it tells you that there's one testing center in Adelaide, there's another testing center in Melbourne, another one in Melbourne or Box Hill, Victoria. We do have Canberra, we do have one in Perth, we do have one in Parramatta, where there's one in Brisbane, and there's also one in Sydney. So you can see the testing centers here as well. If you are overseas, you need to type in your country. So say, for example, you're from Philippines, you search Philippines, and it will also show you that there is one in Manila. It also shows you other neighboring countries that do provide it. So there is one in Hong Kong, one in Taiwan, one in Guam, and one in Saipan, Northern Mariana Islands. So this is where you are going to go if you are confused as to where to take your test. We were talking about the test plans as well a while ago, and the test plan is a summary of what will come out in the test. And as I said, we are aiming for 100% passing percentage for our candidates, and that is the reason all of our the delivery of our class is according to the test plan. So it is not the same as a traditional way of learning where you sit down like in the university. So we are actually doing it according to the test plan, because this is how you're going to pass your test. So you can download your test plan in here, and it will tell you what are the things that will come out in your NCLEX exam. So just a very quick overview. I will let you do this on your own after the video, but just a very quick overview. It says here that NCLEX will be asking you according to the different clients' needs. So there is a safe and effective care environment, health promotion and maintenance, psychosocial integrity, and psychological integrity. And you can see here as well the percentage as to the weight of the questions. It doesn't mean that you provide less value to health promotion and psychosocial integrity because they have lesser percentage in the test plan. It just tells you that there might be about 1 to 2 questions of the whole NCLEX exam for these topics. If you're a visual learner, you can also see here as a pie chart, and it also tells you what part of the test, which one of what part of the test is heavier. So you can see here management of care, which is 20%. And that is the reason why we tell our students that there is no one book that can make you pass the test. We have a very good resource for the management of care, which is 20%, which I'll show you later on. And that is the reason why we really recommend the students not to rely in just one book. And I know that it could be the way that we were taught back in our university, where you study one book and that will make you pass a test. This is an American standard, now an Australian standard of test, where there is no one book that can make you pass a test. So if you go down, it will also tell you with a safe and effective care environment, management of care, which is 20% of your test. And these are the items that will come out during your exam. So if you read thoroughly to that, there are more detailed explanation as to what advanced directives would be and what are the kind of questions that will come out in your advanced care directives. And this is how we teach our students, because again, we want you to pass your test. So if you go scroll down to the bottom, you can see that there are also sample questions, and most of our questions in our question banks are being asked in an NCLEX way. I know that Mosby and Saunders are a very good resource for your NCLEX. However, the way the questions are asked is quite not similar to how NCLEX is being asked. NCLEX questions are very comprehensive, and this is how, and these are like, the questions that will come out. So in our learners portal, which I will show you later on, we will be giving you this kind of questions because these are close to real NCLEX questions. So if you go down to the bottom as well, you can also see some terms that NCLEX will be using throughout your test. This could be very different from where we trained before, and it is very important that you know the terms that NCLEX will be using. So just scrolling it down. Okay, so the different NCLEX terminologies are also found here. So you can probably see in your test client. So client would then refer to individual, family, group, which includes significant others and population. I know that where we were trained overseas, our client would be our patients, but our client does not only deal with patients, it deals with their family and their group as well. You can see primary healthcare provider. You can see the UAP, or unlicensed assistive personnel, or what we call as an assistant in nursing in Australia. So these are the different NCLEX terminologies that you will also be getting. So there are 3 scenarios where you will be judged as passed or fail in your test. And I would like to discuss this in depth because students are also asking, how do we pass or how do we fail the test if there is no passing percentage? So the first scenario is a 95% confidence interval rule. And what it means is that the computer will stop administering the test if they have 95% confidence that you are safe or 95% confidence that you are unsafe. What it means is when you answer your test, if you answer your test in a safe level or above the safe level for 95% of the time, the computer will stop. Or if you answer your test below the passing level or the unsafe level for about 95% of the questions, then the computer will also stop. So the minimum question that you will be getting is 75 items, where 15 items is a practice test. So the graded item there is would be 60 items. The next scenario is maximum length exam. So this is where the candidate's ability levels will be very close to the passing standard. And at this time, this is where you finish all of your test questions. However, NCLEX cannot determine from the 95% confidence. So in that case, there will be special consideration. They will check as the markers of the test as to whether or not you're safe or unsafe practitioner. So if the final ability will estimate above the passing standard, then you will pass. If the final ability will estimate that you are below the passing standard, then you fail the test. This time, this is when you actually answer all of the questions of the test. You have exhausted all of the items, which is at the moment is 145 items. Business as usual, where there is no COVID, it is 250 items, with a 15 trial questions, which makes it 265 questions. The next scenario is scenario 3. You have run out of time. So you haven't finished all of your questions, but you have finished 5 hours of the allocated time to you. With COVID, they have increased this test from 4 to 5. Business as usual, when there is no COVID, it is normally 6 hours. So at this point, we will be discussing the 5, but bear in mind that when everything gets back to usual, it will be 6 hours. So when you run out of time, you've finished all your 5 or 6 hours of the test. NCLEX will then determine your final ability estimate for up to the last 60 items. So say, for example, you have finished, say, 120 items of your 5 hours. What will happen is they will then check your last 60 items and check whether or not you are above the passing standard, or you are below the passing standard. So these are the 3 scenarios where NCLEX will be checking whether or not you pass or fail. So another thing that I would like to cover is your aside from your testing center, is what will happen if you fail the test. So we said here that you need to wait for 45 days between each exam, and that would mean 8 exams per year. That is not our goal, again, but in case you fail the test, then you will have 45 days for you to actually book your test. So you need to go back to APRA, tell them that you plan to take the exam. You will then again re-register with Pearson VUE and pay the fee of $350. Then you book for your test for the next 3 months by the time that you get your ATT. Another thing that I'd like to cover would be the FAQs, or the frequently asked questions. You can have a look at this yourself if you have more questions. This is very comprehensive and very detailed for all candidates, and I would recommend that you go to this website for factual information. So what the exam looks like, I think this is most of the questions of the students. So in the exam, we've said that there are different terminologies, and you can see that in your test plan. The need to know drugs, and this is the reason why we say there is no one book for you to study, because NCSBN does not specify a list of medications that are in your exam. So that means that you need to go through different resources and different types of drug handbook. There is also the cognitive level, and this is where I need to specify and I need to stress out. Since the practice of nursing requires application of your knowledge, your skills, and your abilities, the majority of items are written on the application of the higher level of thinking. Most of our students will ask, do you provide theory classes? NCLEX says that it is about the application of your knowledge, skills. Your majority of your items are written at the application or higher level. If we go back to the university days where we discuss what is potassium, what are the functions of your potassium, what is the circulatory, how does your heart pump blood, or what is the circulatory system, as much as we want you to listen to us explaining that during our classes, this will not help you in your test. So we already know that you have encountered circulatory system. We already know that you have encountered ACE inhibitors medication. We already know that you have encountered sodium potassium. We already know that you have encountered your digestive system. We already know that you have encountered diabetes mellitus. So we do not give that lecture in the class, as this will not help you pass the NCLEX. What if you don't really know? We do have our mandatory learning prior to you attending the class, and these are pre-recorded videos of your educators that outlines the basic knowledge and concept that a registered nurse would already know. Remember, you're capable. Remember, your nursing council has given you a license. That is a big deal. Why? They are actually thinking that you're capable to look after a human being. That means you need to know what are these terms. These terms that we will be discussing are not new terms. They are not new concepts. They are concepts that you learn from the past. So if you require additional support because you do not know what these concepts are, we do have our mandatory learning that you need to attend prior to the class. Average time is 2 hours. Your educators have provided these recorded videos on average of 1.5 to 2 hours for you to be able to grasp these concepts before you come into the coaching session, where we will be teaching you how do you address NCLEX questions according to a higher level of thinking, which actually will be asked in NCLEX. If we want you to pass, this is how we are going to deliver. If you think that theory classes are very important, and the mandatory videos and the mandatory reading materials that is provided to you in your learners portal is not helping, then we are very happy to arrange special classes for you at a university level. But then again, um, APRA has trusted that you are now registered nurses in your country, and this should be in a university level knowledge that you have at the moment. However, again, we said if there are factors that are affecting you don't have that knowledge, we are willing to provide special classes to you at an additional price and cost, and that is something that we can discuss. So we will be showing you as to where the thought process that APRA has, that NCSBN has recommended, and we will be telling you why it is important for us to teach you the problem solving skills, the analysis, the application, the evaluation, the synthesis of things. This is what's going to come out in your NCLEX. NCLEX will not ask you what is the normal potassium level, which you already know. If you don't know, we have mandatory learnings for you to know that. If you still cannot understand, we will provide you special classes. But when you come into our class, we will be teaching you question strategies, just like how you're going to prepare for your PTE exam, just like how you're going to prepare for your IELTS. We are not going to teach you when to use I, we, me, she, or he. We will not be teaching you that. That is something that you already know prior to joining the coaching classes. We will be teaching you strategies as to how you're going to use them for you to pass your test. It's just the same as NCLEX. This is how we're going to teach you. This is a program that our educators have designed. Our educators have been teaching NCLEX. One of our educators have been teaching NCLEX for the past 20 years. And most of our majority of our educators actually did pass their MCQ. You need to trust the people who has been there already, and you need to trust the people who has been nursing and trained in Australia as well. So I think that will cover the reason why our program is quite different, because you go back. This is how we are going to deliver, because that is how NCLEX is going to ask a test. Majority of our students said that 15% of the questions were based on on basic knowledge, and that was in the beginning of the test. However, majority, 85%, are actually on a higher level of thinking, which we do teach. So we don't want you to miss the 15%. However, we want you to pass by getting the 85% as well. So I think this is going back to our values. This is a teamwork where you, as a student, will not depend on your educators to put all of the knowledge to you. Um, we are here to support you, but we know that you're capable already, being registered nurses in your country, being able to graduate in the university, and having your nursing council trust you that you can look after a life of a human being, and APRA trusting you that you have the cognitive level of a bachelor's degree. And again, we are here to support. If that is not what you are at the moment, that is not the level where you are at the moment, happy for you to discuss it with us for special classes. All right. So I think if you would also check our NCLEX items bank rotated, it is quite difficult for tests to be repeated. And that is the reason why it's a very measured test, because they have enough, more than enough questions where students are not able to share what has been asked as well. So all of these information are really valuable. So if you would have if you would like to know more, I would say go to the NCSBN website. It is very important that you listen as well to your friends. Very important that you listen as well to your agents. However, if you really want to know correct information by yourself and from yourself, you go to this website, because this website will give you factual information. All right, so going back. So this is Bloom's taxonomy, and this is what NCSBN is telling about the cognitive level. So you can see the knowledge and comprehension. These will not be majority of the NCLEX questions. It is very important for you to have knowledge and comprehension that you can find in your mandatory learning prior to attending our coaching sessions. However, in your coaching sessions, we won't be teaching knowledge and comprehension. We will be teaching you how do you apply, how do you analyze, how do you come up with a solution, and how do you evaluate everything that you've learned from university. So this is a higher level of thinking, and this is what NCLEX questions would be. And that is the reason why we teach you in this level. What is exciting about our NCLEX? We do have an 8 weeks of program. This is very flexible. You can attend either morning or evening sessions depending on your work. We understand that you still have to work, and we also understand that you have other commitments, and so it is very important for you to have your work-life balance as well. So 2 hours in a day is what we would ask you to spend if you really want to pass your test. We do have 5 full days of final coaching, and that is on the 8th week. And we do have your readiness exam, which I will show you shortly. We do have polishing sessions as well. So your final coaching, once you finish your final coaching, we then ask you to do your readiness exam. After your readiness exam, we then ask you to do some polishing sessions also. So your resources, we have pre-recorded videos that would tell you about basic knowledge and concepts, and they are recorded by your NETA educators. We do have about 12 NCLEX resources integrated in your learners portal. We do not believe that there is one book that you read from top to bottom, you'll pass the test. We would recommend a lot of books that you read from top to bottom for you to pass the test. There are about 5,000 questions from our mock test and practice test, but over 10,000 questions from our resource books. We do have 2,000 questions from our NCLEX question bank, and we have uniquely designed NCLEX and ETA tools, and also we do a higher level of coaching in the class. And as I said, it's not going to be a theory-based class. It is going to be a coaching as to how you're going to address your NCLEX questions based on a higher level of thinking class. So just a quick overview of your learners portal, and this is what I was trying to say a while ago. So if you go to nursingeta.com, if you are current students, you then go to the learners portal, and this will lead you to your resources. So your NCLEX resources will have your 22 lessons, and these would go through all of the course content, and these are your mandatory learning that we ask you to attend prior to the class. So if you will have head to toe assessment, for example, for your class, our very beautiful educators have recorded a video for you. So that's Charlene. Sorry. So there is 1 hour and 31 minutes and 55 seconds video about your head to toe assessment from Charlene. So this is where you will learn the basic concept and knowledge that a registered nurse must know after a university level. When you attend our classes, we will not be discussing head-to-toe assessment. We will be discussing what are the questions NCLEX may ask you when we deal with head-to-toe assessment. If you are not a video person, you don't like to listen or watch a video, then we also did a reading for you. If you're a read and write kind of learner, then you will also have all of these readings for you. So in this case, we're trying to deliver these portal to all types of learners. So if you're not a read and write person, you can go watch and listen to the video. Um, After that, you will have a practice test where it will check your knowledge about the test. It is about 10 to 20 topics, 10 to 20 questions, where we can also see that you have actually done your pre-learning video. So your educators at the back end of the system will actually see whether or not you've done your pre-readings. And it's the best way for us to check whether or not you've done your pre-readings, because that is where we can put in some strategies if you don't have time to do it and you want to pass but don't have time to do it. So then we can put in some strategies for to help you in there. On top of that, you will then have your resources. So we have an NETA NCLEX tools, and this is designed by the NETA educators. We do have medical calculation, and we do have all of the books that you would need, and you can view as well. And also we have our NETA designed references. So you can see that we have the decision-making tool. Most of our students said that if they don't know the answer of the test, this is magic for them. So we are sharing the magic to you. We do have the NCLEX test plan as well if you want to. But we have our tools such as signs and symptoms, assessments, and your must knows. Most of our students have actually put this on their wall to make sure that they would remember basic concepts and knowledge. So on top of that, we also have the practice test, and your practice test would depend on the time that you have, whether you are in a train or you are watching television but want to study. We don't recommend that because we want you to focus during your study. Or if you are doing your afternoon or morning walks and you want to answer your test. So it really depends on your capacity during the day. You can answer 25 questions if you want. You can also answer 50 questions if you want. You can also answer 100 questions if you want. Your practice test are practice test, and this does not replace your mock test. So we do have 8 mock tests, but we also put additional 3 extras. But we encourage our students to have at least 1 mock test per week. You can take this mock test as many times as you want for the next 6 months while you are preparing for the test, for you to be able to gain your level of confidence. Um, we also provide readiness tests, and these readiness tests are from the NCSBN question bank. So these questions that will come out are questions from NCSBN, and these are not the questions, the current questions though, because we're not allowed to do that, but these are previous questions and also practice questions as well. Um, so that is your readiness test, and this is how your course coordinator, Karen, will then be able to identify whether you are ready or not ready to take the test. If you would like to check your the tests that you have done, so you can go through your test history and you can view the details in there, and it will show you what were the questions, what did you answer, and what was the reason. So you can actually review, and then you can retake the test as well. Retake the test as many times as you want until you get 100% of it. So this is your NCLEX, and that is what we deliver. And this is what you can see from your learners portal also. All right, moving on to OSCE, Objective Structured Clinical Examination. So this is delivered by APRA and NMBA, and they deliver this through Adelaide Health Simulation Center. It is a practical component, and it does not only address behavioral skills, but also check how do you address your knowledge, skills, and attitude altogether. Communication is a vital key here. The test dates are released by NMBA. There is 2 minutes of reading time, 8 minutes of performance time, and all of our students are also trained as to how are they going to do this in that particular number of time. I mean, in the certain amount of time. If you pass, you're very lucky. You will then go and register as a nurse, so apply for registration. If you fail, you will have as many attempts as you can. You can book your test again to the next available date. However, you will not be getting the first priority. The first priority will be given to the test takers who have booked their tests for the first time. It is really important for you to then consider the high level of feedback that will be provided to you as to why you fail the exam. So, as much as we don't want that to happen, students will ask, worst comes to worst, is if I fail, what will I do? So, you can rebook your test. There is no cooling off period, not like MCQ. For MCQ, you have 45 days. For your OSCE, whenever the test date is available, then you can book for your test. What is exciting about NETA's OSCE? We do deliver it for 2 weeks of online class. We have 5 full days of hands-on training in our simulation laboratories across Australia. So wherever you are, we do provide it in major cities. Our intake dates, by the way, are in our website. We are doing our Brisbane, Melbourne, and Sydney by January. We have conducted one in Sydney last December as well. Last November. So we have 5 full days of hands-on training, and our resources, we do have pre-recorded videos of skills in the Learners Portal. Again, if you go to that Learners Portal, you can also see your OSCE syllabus here. We put a password on it, but these are all your pre-recorded videos as to how you're going to do the skills as well. You do have your NETA designed OSCE handbook. So we design a handbook for you, and this handbook would contain the skills that are recommended by the NMBA. It also contains the competency assessment, and these are the tick the boxes that also will be provided to you during your OSCE stage. So just a quick reference as to how the handbook would look like. So you will have a handbook like this, and it will show you all the skills that is required of you from NMBA and APRA. And then at the end, you will also get the competency assessment. And these are all your tick the boxes of your skills. And this is how you're going to be graded in your test. So we also have your national standards, tools, pathways, resources according to the Australian healthcare system. And in that as well, we have designed a chart for you. And you can see that in your in the drive, where we'll be sharing you, and you can see different types of charts that we have designed for you. That is just an example of a patient progress notes where you will be doing your documentation. And these are just examples. All right, you also will have your online and face-to-face session. At this point, when you do your online session, this will make you ready to make sure that you know the proper communication, you know the strategies, you know the tick the boxes when we teach the online classes to you. And then on your face-to-face, this is where we do a hands-on training. Our educators have been trained to conduct OSCE, so we do both the educational and the regulatory kind of assessment. And the regulatory, of course, is a simulated one because that's going to be your OSCE. So what is the next step? If you want to enroll, you can go to our website, and in our website would be an online enrollment system. Very easy. You only need to upload your documents that you are being required, enter your details. Our admission staff will then approve your enrollment, and then you can start with us. You will have the access of the learners portal as soon as it is approved, and then you can start the classes as soon as the intake starts. So these are the prices that we have for your NCLEX. It's $2,500. If you want to enroll to OSCE only, it's $3,500. But if you want to enroll through a package, that's a discount of $500, and that is $5,500 with an initial payment of $1,500. This is a sample timetable of our class. So this is your so the yellow ones here are your Mondays, Tuesdays, and Wednesdays. We do have 9 to 11 a.m. sessions for your NCLEX, 6 to 8 p.m. sessions as well for your NCLEX, and a Monday to Friday, 6 to 8 p.m. for your OSCE online. Your Thursday is where we would encourage you to do your mock test, and your Friday and Saturday is where we would encourage you to do your mandatory learning. So you would catch up if you would need more support to have the knowledge and skills of a university level graduate. So what do we need from you? As much as we want you to pass, I know that you also want to pass and succeed and be a registered nurse in Australia. Your educators are already registered nurses in Australia, and we are here to help you succeed. So we need your discipline and your commitment. As much as we understand that you have other commitments, you have other things to do, such as your job, for example. If you want to pass, you need to learn to sacrifice either one, so that you will be able to focus on your studies. Your educators are here to guide you. This is a time for you to actually be self-motivated, because at the end, it is going to be your reward. We want you to think like a nurse. We really would encourage you to use your critical thinking and clinical judgment based on the application and the analysis of your learned concepts and knowledge. And then again, I said, if you don't have that basic concepts and knowledge, that's something that we can talk about, that we can offer special classes for you in as an additional service. We are all adult learners, and what it means is that you are capable already. The trust is already invested in you as registered nurses in your home country. You can look after a human being safely. You have all the knowledge that you had during your universities. We just have to recall and polish that again. And also, you have the experience as well, looking after these patients. So this is a shared learning environment and teamwork where we share all our learnings together. And this is where you need to be self-motivated. As much as we want to motivate you, if you are not motivated to pass, then it is something that you need to look into. We do provide psychological safety again. So this is where you're free to tell us your brilliant ideas, suggestions. And in that sense, this is where we also work together. So what we need from you really is your commitment, your time, your dedication, your motivation. And also, when we say your commitment, your time, your dedication, motivation, it's not taking leave 1 month prior to your test. It is that consistency that we need. Your consistent 2 hours a day for the next 3 to 6 months is what we need from you, rather than 1 month of leave prior to your test. I'll make a bet with your 1 month of leave, you do not study whole 8 hours of your leave. You probably would study still at least 2 to 3 hours during the day, and it is also a cramming system, which is not helpful for your memory and for your thinking. So consistency is the key. It's not one month leave. It is the consistency and the discipline that you put yourself in the next 3 months of your preparation. So as I said, this is the level of the cognitive level, the Bloom's taxonomy, but I want you to concentrate on this circle. And this is what I was talking about, your 1 month leave. Here is your comfort zone, and this is actually the zone of proximal development. A study was conducted as to how you would improve your learning. And this is how the educators are also trained, and this is also how we are also applying these concepts or this model. So in your comfort zone, there is less learning. This is when you wake up every day at 10 o'clock in the morning, or if you want to attend the class at 9 to 11, wake up at 8:45, attend your class 9 to 11, and then be comfortable and rest throughout the day. This will not help you in your learning. What will help you is extending 2 more hours of that 2 hours that you spend during the day, going outside of your comfort zone, because that's where you will be challenged. If you used to wake up at 10 o'clock in the morning, wake up at 8 o'clock and study. This is where you can challenge yourself. If you stay in your comfort zone, there is minimal learning, and that will not help you pass your test. If you go to the red or the pink color, which is your panic zone, this is also where there is very less learning. And this is when you actually cram to take your 1 month of leave, where in that 1 month of leave, every day you probably would spend 2 hours in a day. There is minimal learning there as well. It is very evident that if there is an incident where you are panicking, you can't think and you can't focus, that is the same as your NCLEX. If you are panicking because your NCLEX test is fast approaching, then you cannot learn. We encourage you to be in your growth zone, which is the yellow one. This is challenging yourself a little bit, not to the extent that you panic, but it is actually the consistency that you actually are committed, dedicated, and motivated to learn. It is sitting down there for the first 4 to 5 hours to do your 250 questions of mock test. If you do not do that, what will you do when you reach to your NCLEX test? It's like running a marathon. If you're comfortable running 1K in a day, but when you go to the real contest of the marathon where you are running 50K, if you haven't been there to the 50K, you cannot reach to that destination. You'll feel exhausted, you'll feel tired, you'll feel overwhelmed in the first 5Ks. And that is not what we want you to do. we want you to actually go out of your comfort zone, feel how it is to answer 250 questions every week. Because by the time that you sit down in that NCLEX chair, when you go to your Pearson VUE test and you have done 8 to 12, or even your readiness test, which is 6. So if you have done 20 of that mock test, it will give you more confidence, and you will know what to do when you have that tingling sensation in your legs, when you are really hungry because you haven't eaten much. You will know how it feels, and you will know how you're going to address that problem while you are taking the test. So, what is exciting about our educators? We are a team. So, these will be your lovely educators, and we are still growing. There are still a lot of us that's not included in this picture, but your educators are actually Australian trained, qualified, registered nurses and educators. What it means, we are the educators that have passed the NCLEX and are also OSCE trainers in Australia. And we are trained in Australia as well. If you want to get your RN or your registration as a nurse in Australia, I bet you need an Australian trained educators as well. All of your educators have post-grad qualification to do clinical teaching. So they are not just the experts, they actually have experience as well in clinical education and adult learning. We do have postgraduate qualifications as well of the area of specialty, and we are all qualified trainers and assessors. I am putting my trust in the educators because I know that they are the cream of the crop in Australia. Most of us are working in prestigious local health districts in the country, and of course, very well experienced, very well trained with with high qualifications. Um, so we are young and vibrant educators. So we don't admit that we are getting old. And you can see us in the pictures. We are really the educators that practices the current and evidence-based practice in Australia. In your NCLEX and your OSCE, the test makers are actually university teachers, and the test checkers are actually your clinical teachers. You are very lucky to have all of us who are working in schools and universities and colleges, and also working in the clinical area. So you have the best educators. We are clinical leaders in major hospitals and healthcare facilities. And what does that mean? Not just educators, we are clinical nurse specialists, clinical nurse consultants, and nurse unit managers or nurse managers as well. It is good to have that connection. You will need us in the future. The nursing world is so small. I still meet my previous students, and I'm still in touch with them because there is that 6 degrees of separation that you know someone from someone, and reference checks, jobs, employment opportunities in the future. You will meet us again. So, what is exciting about our team? We are real, we are here, we exist, we are dynamic, we are vibrant, we are everywhere. We stand by our vision and our mission and our values, and we are here to support you. If you have further questions, if you have or brilliant idea or information, please reach out to us. We are located in Sydney, and our main office is in Wagga, but feel free to give us a call. That is our number 1300 00 NETA or 6382. That is also our mobile number. Our website is www.nursingeta.com. And if you want to reach out through email, you can reach us out at info@nursingeta.com. It is my pleasure to give this information to you all. And it will be much of a pleasure if you reach out after watching this video. If you have any other questions or if you have any clarifications, please feel free to give us a call or contact us, and we will be very happy to help. I think that's it. Thank you very much for listening. We will be in touch again.